But let's start our today's session. So welcome everybody. This is the first winter meetup of 2025. This winter we will have 3 sessions. Today we will be talking about practical uses of anonymous synthetic data in healthcare. We have launched earlier in January, I think it was a week ago, a hackathon, which will continue for some weeks still, and there will be an award ceremony of this hackathon competition in February's meetup, and then in the March session we will talk about data spaces, so explaining the different approaches to achieving the same objectives, meaning access and the analytics of data with European health data space and the pediatric health data space approach, which we have are aiming for in our project. To all meetups, you can register through the LinkedIn posts or the PHEMS website. So please follow up those, and then also at the end of the presentation there will be a QR code which leads directly there. Just a very brief recap on why PHEMS project has been launched. So in pediatrics, there is an urgent need to make possible collaboration with the data across borders. Pediatric hospitals typically treat patients where the patient counts are low, meaning that if statistical power wants to be obtained for scientific research, we need to somehow be able to combine the patient's information across borders. If we want to analyze real-world evidence of new therapies, we also need to collaborate more extensively with data. Engagement with medtech industry and innovation ecosystems, especially in the field of artificial intelligence, model development, model validation, requires large amounts of data, where often individual hospitals, even though they might be very big, cannot provide sufficiently with, so we need collaboration on those topics as well. Especially in the tertiary care of children. So many countries only have 1 or 2 children's hospitals. So any type of benchmarking or quality and process development based on data comparison is impossible within the nation-state borders. So we need to work with approaches to enable these activities cross-border. The project is financed by European Union, Horizon Europe program, and UK Research and Innovation Agency. It includes 14 partners, and we will be running for 3 years. We are almost halfway of our project, so we are currently going on month 16. The core of the project is pediatric hospitals or departments or pediatrics in general hospitals in Helsinki, in Barcelona, in Rotterdam, and in London. Also supported by Riga and Florence Children's Hospital, and group of technical and business company partners. Next, I would like to introduce our speaker of the day. So Dr. Mehreen Ali is the research director at Veil.ai. Veil is our partner in PHEMS, specialized in privacy enhancing technologies. And Mehreen is one of the founders of Veil.ai with a background in bioinformatics and machine learning. She has extensive experience in machine learning research, cancer research, and now more recently in developing anonymous data AI solutions, which are also used in our project. Mehreen, the floor is yours.
Thank you. Thanks, Pekka, for the introduction. Hello, everyone. and good afternoon. I'm excited to be here to discuss the practical uses of anonymous synthetic data in healthcare. So let's look at the agenda first. So we'll start exploring the role of AI and data in healthcare first and the challenges that are there. Then we'll learn what's synthetic data and what are the practical uses of it, and some of the challenges that are associated with synthetic data. And towards the end, we'll explore anonymous synthetic data and how Whale AI is helping PHEMS achieving that. And then I will end with some key takeaways. So let's start with AI and data in healthcare. So in modern healthcare, data is the lifeblood of research, innovation, and patient care. Artificial intelligence is playing an increasingly crucial role, helping to analyze health data to improve diagnosis, treatment, and operational efficiency. Here I have listed some of the recent notable applications of AI in healthcare, including AlphaFold, large language models, and AI-assisted disease screening methods. Despite AI's potential, data scarcity remains a key barrier. Access to diverse, high-quality datasets is limited, especially in rare conditions. Moreover, privacy regulations such as HIPAA, GDPR, EU AI Act, and EHDS create a dilemma that how can we share data while ensuring patient privacy. So today I'll walk you through how synthetic and anonymous synthetic data can help bridge this gap. We'll start with a scarcity of data. Let's see what's synthetic data. So synthetic data is artificially generated data that mirrors the statistical properties of real-world datasets. It can be generated using imputation, data augmentation, rule-based simulations, or generative models like GANs. The key advantage is that it may allow researchers to work with realistic data without exposing sensitive patient information. Synthetic data is already being used across multiple domains, from electronic health analytics to medical imaging. It can enable collaborative research while protecting patient privacy. So let's look at some of the specific applications. Synthetic data for AI training. AI models require a vast amount of training data to function effectively, and synthetic data helps by expanding training datasets. It may improve accuracy and fill in gaps for rare conditions and for underrepresented populations. It can particularly be useful for feasibility studies before deploying real-world AI health solutions. Next, we have data sharing for AI development. So synthetic data can also lower barriers to entry in AI development. It allows safe data sharing for stress testing new digital health platforms and large-scale AI ML competitions and hackathons. A great example is the COVID-19 Open Research Challenge on Kaggle, which leveraged synthetic data to accelerate medical research. Then synthetic data, besides AI training, is also useful in developing and testing healthcare systems, especially when we're talking about synthetic electronic health records. It can also be used for training and educational purposes. One of the best-known synthetic EHR generators is Cynthia, which can simulate entire virtual populations, covering from birth to death, and it can include patient demographics, clinical events, and disease progression. Here are some of the recent applications of Cynthia for creating simulated datasets. For instance, COVID-19 dataset provided longitudinal data for pandemic response studies. And the plot, we can clearly see for some of the lab values, how closely the simulated data is following the training data. So all of the plots, like the ones that I've shared here, they are following that trend. And you can follow the article for more details on that. Similarly, Cynthia has been used to generate a synthetic mass population based on the Massachusetts population. Then it has also been used for to generate synthetic medication data. And these are the studies that have shown some clinical validation as well. So you can follow the articles for that. Further, we have synthetic medical imaging. So medical imaging can also benefit from synthetic data for generating CT scans, MRIs, and X-rays that may provide researchers with large-scale, high-quality data sets. For instance, we have a MINIM here, which is a medical image text generative model with a reinforcement learning from human feedback strategy. It has potential for generalistic medical AI as it is able to generate multi-organ, multi-modality images. Then we see that in the clinical validation path, through data augmentation, MINIM has been helpful in improving the diagnostic performance by up to 17%. And then for EGFR mutation classification in lung cancer, it has improved the 5-year survival rates from 24% to 53%. Similarly, for HER2 positive breast cancer mutations, the classification accuracy has increased from 79% to 94%. I have added this image from the article that I've showed earlier. There are two tables. So in the first scenario, they are training and testing data on the real world, testing the model on real world data. While in the second case, they are using synthetic data along with the real data for training the model and then testing data on the real data. So if you follow this, if you can follow my my cursor, you can see that how the numbers have changed from just using real data to using mixed data. So that's the power of synthetic data when it has been used for data augmentation. Despite its advantages, synthetic data has limitations. So high-dimensional and complex longitudinal data can suffer from quality issues due to the curse of dimensionality. Additionally, generative models may memorize training data, increasing re-identification risk. Synthetic data can also be biased, and it's mainly recommended as test data, not for downstream analysis or for doing real research. And it's very crucial to assess the suitability of synthetic data for specific use cases before proceeding with the results. Now, if you remember one of my initial slides where I was talking about these challenges with data and AI in healthcare, let's look at the privacy and innovation dilemma, since we are in the healthcare field and privacy is an important aspect of it. To understand the anonymity concept, let's look at the GDPR recital 26 definition that specifies that data is considered to be anonymous only if identification is no longer possible given current technologies and costs. It also, like if you follow this definition, we can clearly say that not all synthetic data is automatically safe. There needs to be anonymity of synthetic data should be verifiable and tested before calling it anonymous data. True anonymization requires that the data should not be linked to any individual either directly or indirectly. So this is where anonymous synthetic data comes in. Yeah, if you look at the image on the right side, you can clearly see that there is an overlap between anonymization and synthesization processes, and the overlap is where anonymous synthetic data lies in. This is a very famous image that that we often use to explain the data privacy categories. And let's look at this. So traditional pseudonymized data remains subject to GDPR regulations. If you look at the first cell and the red one on the left side, the first one is the original data. This is the raw data. That's how we receive data from the clinics. When it's pseudonymized, some of the identifiers are removed, but it's still subject to the GDPR regulations. However, truly anonymous data, when verified, falls outside GDPR score, as you can see on the right side. So we have anonymized data and we have anonymous synthetic data, and it's not personal data anymore. This makes anonymous synthetic data particularly valuable for privacy-preserving research and AI innovation. Now let's look at the role of Whale AI in PHEMS. In the PHEMS project, Whale AI aims to produce high-quality, individual-level anonymized and synthetic data for secondary use of healthcare. And these datasets are then tailored to PHEMS clinical use cases, enhancing privacy protection. Through PHEMS, we are also maintaining the data quality and maximizing utility of this anonymous data for healthcare innovations. You can learn more about Whale AI next generation anonymization at our website. This is a big picture of PHEMS project, where we are supporting a network of 6 children's hospitals by developing next generation anonymization and synthetic data generation capabilities. So this brings me to my last slide now, and I would like to wrap up with 3 key messages. First, anonymization combined with synthesization is more privacy protective than synthetic data alone. When anonymity is verified, it significantly reduces re-identification risks, and we can safely say then anonymous data is GDPR free. However, depending upon the use case, perhaps anonymization alone is also a better choice. Second, anonymous synthetic data can significantly improve AI development and boost AI accuracy, mainly through data augmentation, as we have seen in the example earlier. Third, rigorous validation of anonymity is essential to ensure safe data sharing. So we cannot skip the anonymity validation part. That has to be done whether data is anonymized or whether it's anonymous synthetic data. With that, I would like to end this talk. I think I have ended it quite earlier, but this gives us enough time for questions then. So thank you for your time, and I'm happy to take any questions now.